Hi, I'm Anita Go. I'm from the National Aging Research Institute, and I'm going to be presenting today with Veronica Oglivy about strategies to maximise the recruitment and retention of home care workers in dementia research. And I'm very happy to be here. I'd like to acknowledge the traditional owners of the land on which I am now, which is the Wurundjeri Woiwurrung people. And I acknowledge the stories, traditions and living cultures of Aboriginal and Torres Strait Islander peoples on this land. And I would encourage you to reflect on whose land that you are on today as well. So today I want to talk about home care workers and their participation in dementia research. So these are the workforce, often called personal care attendants and community care attendants as well, that really have a crucial role in community care. They improve quality of life and promote independence. They help people stay at home for as long as they wish, and they really are a crucial source of support, including for family carers as well. We know that they're time poor, so this workforce often drives around from client to client, providing multiple care tasks for each client, but really their participation in research is essential to the development, adoption and integration of evidence-based dementia interventions into practice. So this would lead to quality dementia care and better outcomes for people living with dementia and their family. So in our study called PITCH, so it's the NHMSC funded Promoting Independence Through Quality Care at Home project, we co-designed a dementia training program delivered to home care workers. And then we tested it in a pragmatic stepped wedge cluster RCT in the 3 most populous states of Australia. So Victoria, New South Wales and South Australia. We did a whole suite of measures, but our primary outcome measure was the home care workers' sense of competence in dementia care provision, as measured by the SCIDS. If you're interested, here is our study protocol published in Trials, and here's the QR code that links to it, where we had 18 geographically disparate clusters from 7 service providers. We randomised them to intervention and control arms. So you can see the 7 service providers down there. How did we go with the RCT? Well, here is our consult diagram. We baselined 226 home care workers. We had 150 in visit 2 and then 100, and that's 6 months later, and then 115 in visit 3, 12 months later. And this is remarkable considering the time frame in which this RCT was conducted, which we'll talk about a bit later. In terms of the recruitment and retention strategies, we used a lot, some of which you can see here, but we don't have time today to talk about all of the strategies that we use for recruitment and retention. And I'd be happy to talk to you about these in the question and answer session. But what I want to focus on today is this concept down the bottom here, where we embedded a research assistant, presenter Vonnie, within a service provider. And in my point of view, coming from an investigator on this project, this was really invaluable for recruitment and retention. It really led to trust, legitimacy of the study, and also the consistency of the same person employed by the organisation contacting the home care workers and the clients as well. So I'm going to hand over to Vonnie to tell you about her experience.
Hello everyone, my name is Vonnie Oglivy and I've been assisting with the PITCH project over the past 18 months. A little bit about myself: I work for Helping Hand Aged Care in South Australia, and I have for over 30 years as an enrolled nurse. 3 years ago I was asked if I would do some research, and I have really enjoyed doing something different, and it's been very rewarding. I'm employed by Helping Hand, but through an agreement with NARI, we have been fortunate to be part of the PITCH project. I started off by recruiting clients and their carers from both metro and country areas, and then recruiting home care workers that were linked to these people and that they cared for. I found with the clients that I visited over the past year, for the ones that are still in their own home and with their loved ones, they are so happy and grateful to be able to stay home with their belongings and their loved ones around them. The concept of having better trained home care workers and more support for families and clients living with dementia and keeping people in their own home longer is the ultimate goal. It was amazing how much the clients and their carers enjoyed the visits and the surveys and going through the surveys with me. They really were passionate about making a difference and in the future, and were determined to complete the project with me. I felt the same with the home care workers that I recruited. I met with each of them individually, and I was in awe of their compassion and emotional connection with the clients that they visited. Most of them were so excited to do the training and complete the surveys. They are all extremely special people, and I felt privileged to be able to give them this opportunity. I would just like to say this experience has been amazing and one of the most rewarding things I've done. I feel extremely privileged and have been to have been part of it. Thank you so much.
Thanks, Bonnie. So through all of our efforts, the trial met its required sample size and all clusters remained in the study, which was a great result. 226 home care workers completed baseline, 76 dropped out before the first follow-up visit, which was our primary outcome measure, was measured. So this is a 33.6 dropout rate. We looked at the factors associated with dropout using logistic regression at ANOVA, and we found that participant retention was not predicted by state, service provider, demographics, dementia attitudes or knowledge, sense of competence or care strain. And here are just some figures showing you that there's really not much difference between the home care workers that were retained in the pitch study and those who dropped out or withdrew from the pitch study in any of the scales, nor what state they came from, their identified gender, or whether they identified as culturally and linguistically diverse. So you can see that there's not much difference between the dropouts and those who stayed in the study. So in terms of just the study and what it means for dementia research, we know that the home care workforce has unique challenges to participation in research, including organisational barriers. And really minimising these barriers is really critical to conducting quality research in the home care sector. We know that recruitment and retention can be positively influenced through multiple strategies, such as the ones that we used, which led to a 33.6% dropout rate. So we know from the aged care workforce census report that there's a 35% attrition rate or turnover in the home care worker sector anyway. So our number really reflected this kind of natural attrition or people leaving the sector. And this has also been exacerbated by the pandemic. And as I mentioned before, we conducted this pitch study in a unique timeframe. So we had the new aged care standards, we had the Royal Commission on Aged Care happen within that timeframe, and we also had a global pandemic with COVID-19 as well, which obviously affected people's ability and motivation to do research on top of their care work. So to bring it all home, really the key message, I think, is that home care worker participation is really essential to develop, adopt and integrate evidence-based dementia interventions into practice and ultimately to provide quality dementia care. And if you're doing research in dementia, I think it's really important to address these recruitment and retention strategies. And ultimately, home care workers will help people like Bill and Margaret here, who are some of our pitch participants, stay at home. And here's them on their 60th wedding anniversary. This study is a big one and it couldn't have happened without a large group of people, including family carers and people living with dementia. So thank you very much to all of our partners and the team members, and thank you for listening, and I look forward to seeing you in the Q&A session. Thank you.